Dr. Veena?
Hello. Yes, sir.
Hello.
Yes.
Hello. I can hear. Yes.
Good evening, sir. That was indeed a great presentation. I'm Dr. Veena from Chennai.
Yes, ma'am.
My question to you is like, sir, many of the forward messages in the social media, people aren't aware that whether the news is authenticated or it is fake news, and they keep forwarding it. Is there any how to curtail these things? Is there any procedure or
Yes, ma'am. I think this India Today, they have this some collaboration with it. I'm just telling you. Just I'll if you want, I can share in that clinical psychology group or somewhere.
how?
Yeah. So this group of hello.
Yes, sir. Yeah.
Yes, ma'am.
Dr. Veena, you can go ahead.
Yes, sir. Okay, sir. And one more thing is, right now during this lockdown period, everyone is like accustomed to lot of social media or watching television. So, is there any threat of them getting addicted to this? Because uh, even I feel sometimes like if I don't watch my mobile, it's like a sort of alarming. Like, oh my God, is there any news that's on my mobile or something? How to come out of this thing? As professionals, we know the effects of getting addicted. In spite of that, we sometimes do have this feeling.
Sir? Yes. Hello. Balbinder, sir? Yes. Dear experts, and I think there are many of them here. Would you like to add on any points on her questions? You are welcome to share your inputs on that. Even I too thought that Dr. Veena, suppose this is the time we are spending a lot of time in front of the TV and mobile phone, and whether this is an addiction or not. Yes, sir. Sir. Yes, sir. You can add on your.
We are spending more time on Zoom now.
Yes.
Recently,
You know what? We all know. Sorry, can I go ahead?
yes, sir. Please.
Yeah. Okay. See, you know what? We are all. As a human being, we are trained to look at only negative things. Okay, and it takes lots of efforts to ignore negative stuff and look at the positive things. So I always say it in in any lecture or something, workshops or something like that. That time I will say, I'll tell them to find what you see on the wall. They will see there is a scratch, there is a dirt, something is there. So like that they will say, because we are trained to do that. So I have a neighbor. Morning 6 o'clock, he will say, I don't like anything here. She is 72 years old. Old lady. She works in a hospital. Very hardworking lady. But the first thing I will hear from her, "Yanakku pidikave illa." That is what she will say. Okay. So, but over a period of time, because I consciously worked out on this, and whenever I see the paper, I'll see only the positive stuffs. For example, in the Times of India, I read Times of India. There I see farmer gives away 7 tons of vegetable free. That gives a great feeling. You feel very happy about it. Okay. Then you say that, it is also okay. We are all very much in rituals. We believe in it. Many of us. So, this information, like, now connect to God at a click as pujas go online. See, these are the things, when you look at it, you feel happy. When professors virtually turn into students. See, many of us, we teach. Now we are also learning lots of things. You get into some online course, something like that we are doing. So it is, it is very, very important for personally also to get trained, to consciously make efforts to look at positive stuffs, not to get addicted. Thing, only thing now, maybe after some days after this COVID or something, we will sue Suresh Kumar for making us Zoom addiction. Okay, that will happen, but otherwise, like, we are so much addicted to, it used to be Facebook, now it is, WhatsApp. This is what happening now. I am making conscious effort not to look at for messages, looking for, craving for messages. I don't do that. So I think, it is very, very important for us, and as well as a professional. And when we or in the family gathering, when we are looking at people or children, then we have to help them to divert them from these gadgets, and getting stereotyped, and get onto that. And even the parents, see, for them to do the work, they are giving there's a mobile to them or tabs to them. So these are the things, we get into the addiction, and we make them get addicted to that. And and I have seen people, Balbir ji, aap to you have sent me one your study, also you sent me, I hope you remember, about you make somebody, who was so many hours he was addicted to
We
mobile.
had discussion about it.
Yes.
Texting addiction.
Correct. Okay. So, it is, like, we also to get, practice ourselves to not get into that trap. And we have to, since we work on it, we know how difficult it is. We have to help them. We have to help the children, parents, and others, to not to get into that, and how to get over it. That we have to do. I think it's a huge responsibility as a professionals we have to do. See this, I'm a little scared about, to become, become an OCD, because I keep washing my hand. And see, in our house, the moment you get out of the house and come back in, you go to the bathroom and wash your legs. That is what we do. So now,
Sir,
inside the
think
house
about
itself,
those.
sorry.
Yeah, but think about those who are at the border of these problems.
Nah, exactly. That's what I'm saying. That's what I mean. I myself is, getting scared of, becoming, this is becoming too much of it. And so I see when it is necessary, I am doing. Okay. So I'm making conscious effort to do that. So, we have to teach, make them practice also. So that is what we have to help them.
Yes, ma'am, Veena ma'am. So yours is that India today, they have their team to check this and verify whether the news is authentic or not. So
And also one more thing I want to say, I hail from a place called Kanchipuram. No, now I live in Chennai. There is a school which doesn't have a bus. I am getting, about 5 years ago, when WhatsApp came into existence, within a year, there was one bus accident took place in that particular school. And, some children are died, please ask for ambulance. That message, even I get it today. And nobody bothers, and there is a number given. Nobody bothers to even check, before forwarding, they can check. Why don't they check? They keep just, they are so happy to forward, they like barging on to help,
There are two messages without any thinking, rational thinking, they will forward. One is if you are Indian, you forward. Another one is. And another
Yeah,
one.
that Infosys interview.
Yes. And if anything, they are, need a help. If you forward, they will get 1 paise. They thought that they are sending message, they will get a money. So these are the information they are. Some of the people are unknowingly they are doing it, and some people, even they are educated, they are doing these kind of
No,
mistakes.
see, they don't make effort to check it. One call, you are taking so much of pain to forward it. Why don't you call up and check, whether it is true or not?
Yes. Yes, you are right, sir.
they just have a taste of sharing whatever they have. They
Yes.
think
See,
others would like it, others would think that this person is having a lot of information. This is all.
So earlier
Suresh,
we had there is a features in WhatsApp we can forward to any number of groups, but now they restricted only 500
restricted
groups.
it.
It is because there are
But this is, Suresh, this
yes,
is what we discuss. When we share, we get more. So it is very scary now.
yes,
So that is the
That,
that,
thing.
that was regards to knowledge, sir,
yes.
not about
I
the
know.
message.
I know. I'm
But
saying
still,
it in the lighter vein.
The,
Absolutely.
Balbinder
So
sir,
we get
actually,
that. I know. In WhatsApp, you get that. That's what I'm saying.
Balbinder sir, I would like to add. I request you. I think you were in the field for de-addiction centers. Can you give some inputs on them? What are the strategies we can adapt to recover from the addictions? It may be social media addiction. It may be any kind of addictions. Can you
Yes,
suggest
sir.
some rehabilitation strategies for us?
I think, sir, I'll share my article. I think you have gone through my article also.
Yes.
Texting
I did.
addiction. So we protocols. One is the complete abhi do sab kuch khatam. That's it. Okay. Other one is the gradual reduction. If you take 4 packs per a day, you make it 3 per a day, then 2. Okay. And there are certain clues for your what you say is for what is called as when we have craving. Yeah, there are certain clues for craving. For example, time is the big clue for craving. If a person is taking alcohol at 6 p.m., at 6 p.m. the ghanti yahan bajti hai there, that it's 6 p.m. I have to go for that. Okay, so that time has to be skipped. Okay, so these are the, I think you, I'll share my article. So
Yes.
that is the basic of gradual. If you want to make it at your home, that is the best strategy. And then the role of family members. Normally when someone says I have slept, I want to have drink, I want to drink, then the family members, they start abusing. Oh, we have spent a lot of money on you for your treatment and all, so again you have that kind of taste, you want to have drink. Okay, this is very normal. Once you have a fever, you got it treated, then again you can have it. Okay, relapse is there. So I think the first case in Japan of COVID-19, they got it treated and he was doing well. Again, the person got infected, or these symptoms relapsed. Okay, so this, if we practitioner, we consider it as a disorder, then we need to accept that relapse is there, and it is part of recovery.
Okay.
So family member need to understand this concept also.
Yes.
Then most of the family members, they think this is a habit, but this is, if we think it's a disorder, then it has to be treated. Habit can be changed. Okay,
Yes. I think
habit doesn't need any treatment, disorder needs planet. And people, family member, it's a family disease. It's not a disease of one person, it's a family disease. If one person is sick or addicted, whole family is sick, they are all suffering. Okay, if after having drunk only, if the person is beating the wife, so it's not the wife who's being beaten. If the children are also being affected, they are mentally beaten, being beaten, they are seeing their mother being beaten by the husband or the father, so they are also psychologically, they are being beaten. Okay,
so.
so it's a family disease. So family, all family members need to be counseled and all.
True, sir. Hmm. So Dr. Veena and Dr. Susri, ma'am.
I'm Dr. Subhashri. I'm from Chennai. To show up there, I would like to actually add upon certain points, either with the chemical, I mean, carving for any kind of substance. I think the detoxification process has to take place, and then we go for therapy. In the therapy, side by we have medicine, and as well as the group therapy, psychotherapy, aversion therapy we provide. And I could see that a lot of family therapy works out very well with de-addiction patients. I mean, patients who are admitted in de-addiction centers. But if you look into the the youth population right now, they are actually not willing to get into, get rid of this habit. Any movie, if you look into, if there is a friends gathering, that will be in Tamil we call it sarakku. Okay, if there is any friends gathering, that will be definitely with liquor bottles. And movies, if you look into it, so they normalize that having a meet with friends is normal to have drink, and it is fine to have as much as you would like to have booze yourself. And it's fine to have hangovers, and we get a lot of female addicted. I mean, there is no male female gender difference in this and all nowadays. So in this scenario, if you look into now with the lockdown period, and Tamil Nadu has closed the task marks, it's very difficult, and we are getting calls. As you said, the disease people are calling us, and we are getting shivering, and we are having withdrawal symptoms, and we are not able to manage. We can only do psychological first aid for them. But this disease need to be treated with the process of, as you said, that de-addiction centers need to take care of detoxification, and then the substance has to be removed from them. Medicines has to be given simultaneously. Psychotherapy has to be provided. So this takes long time. People don't actually understand these things, and people from rural area call us and do something. Let this be a chance for my husband to leave substance use, and let him quit alcohol by this period. It's lockdown itself. Kindly help us to do like that. They want quick and immediate, quick fix solutions. How would you suggest in counseling process for these rural ladies, innocent people? How can they handle this scenario? Please guide us.
Asking me, ma'am?
Question to आपके लिए.
Okay. Uh, I think we were dealing with this because we here in Amritsar, most of the patients are from rural area. So here we had a protocol where the concept of, for example, the families of the recovered patients, they were interacting with the families of those who
I couldn't hear his voice.
what kind of mind when they are quitting this. Can you hear me, ma'am?
बोलिए जी.
Yes, ma'am.
Yeah.
Can you hear me?
Yeah.
Yeah. So their families, they were, they were interacting with the families of those patients who were recovered. Okay, because if we are talking with them in a very technical language in psychotherapeutic mode, then it's very difficult to teach them. We are supposed to be to talk with them in their very layman's language. This is how we used to handle them. So if they are from, even in Punjab, we have 3-4 versions of Punjabi. So we should know what type of Punjabi they are speaking. This is how we used to talk to them. So they can understand why not, because when normally people come out of the addiction, we call here when जब इंसान बिल्कुल जमीन में जैसे पताल में पहुंच गया ना, अभी कुछ नहीं उसके पास, the last resource is to come out of the problem or to die. That's the scene. Most of the patient, those who have faced this scenario, they come out of the problem. Otherwise, okay, देख लेंगे, देखा जाएगा, कुछ नहीं होता. If you say that do you have a liver problem due to addiction, then they would say those who don't have addiction, don't they have liver problem? So there might be other cause. So when they are at their bottom, then they understand this concept. And if you're talking about that how to counsel those who are from villages, we need to learn their language. Their language means the level of words they understand, what kind of language, what is their understanding. And we used to make them relate their family with those who are recovered.
अच्छा. Thank you. And one more with
So system here had employed the family members. Yes, ma'am.
yeah, one more question. Have you also interacting with people with screen addiction, that is, say, the phone or pornography watching
Yeah,
addiction people?
I have treated one patient who had a texting addiction. So I have
Texting.
written texting addiction. So he had similar tremors like as alcoholic tremors. He had that level of severity of the problem. So if you ask him to drop the cell phone, his hand would tremble. So
What did
that
you the
that
what the therapy you have given to him?
When this I started with gradual reduction and the involvement because I was teaching there and I had no setup to treat him. So the gradual reduction I'll share if you say I'll share that article with sir, or if you say so you can find how I have dealt with that situation with that person.
Generally, it is a BMT, that is behavioral modification only you did, no?
Yes, yes,
Okay.
yes, yes. Gradual
Thank.
modification is behavior modification. Yeah.
That,
Acha,
Any other questions, sir?
yes, Dr. Sujata ma'am. Ma'am, can you able to hear me? Dr. Sujata ma'am.
Hello.
Yes, ma'am. Ma'am,
Hello.
yes. 1 minute. Ma'am, hello. I think there's a problem with their connection, I think so.
I think so.
Yes. Yes.
It's network issue.
Yes. Dr. Veena, can you add on some points on how you will deal with the person with addiction?
Which one? Which
and
one, sir?
and especially from homeopathic view, how de-addiction could be handled. Could you please throw some light on it?
Uh, yes, ma'am. See, we have a few drugs for de-addiction in homeopathy. I'm basically a homeo doctor, sir, Balbinder Singh, sir, and I am into counseling. Okay, so yes, ma'am, we do have certain drugs which could take care of this withdrawal symptoms and also the addiction. When we talk about addiction, it's not about alcohol alone. It's about smoking also, uh, about nicotine addiction as well. In practice, I always incorporate both homeo treatment and also a few psychological interventions. Like I take up motivational interviewing, psychoeducation, both for the patient as well as for the family members. So once you start talking to them about the effects with pictorial depictions, like you show them this is what is going to happen to you when you consume either alcohol or nicotine like BDs or cigarettes. This is what, see, when we tell them, they don't understand the intensity of the ill effects. It will not have that much of impact on them. So when you show them these are the things, these are the consequences, and also sometimes we have to not use too much of professional jargons like to Bhayamutramalli. That's not to make them apprehensive. Uh, Tell them in layman language, you will be going to have so and so, you will be going to have lump, or it will eat away your mouth, or it will be creating some sort of ulcer, all these things. And also sometimes you have to become, tap on the emotional weakness of the patient. So when you talk about these things, they start to listen, like, okay, I ask them like, how much of amount do you spend for so and so,
Mm.
and whether you are married, you have kids or not. I Sometimes you have to tap on that, even though it's not professional for us. Sometimes so that there's a saying in Hindi, no, जब घी सीधी उंगली से नहीं आती तो टेढ़ी करना पड़ता है. So we use those tactics. So when you emotionally tell them, show about what did you do for your kids, that guilt factor, definitely he will adhere to the treatment. At least he will say, okay, I want to have the help, I will come for help. And there are certain homeo drugs, I don't know how far you understand. There's like naxwamika, sulfuric acid, and these people also have an apprehension. Your homeo drugs are having ethyl alcohol. Ethyl alcohol is based for homeo medicines. That doesn't mean those patients will become addicted when they take homeo medicines. And definitely, ma'am, me and Suresh Kumar sir and we have talked about it like we will have a research, sir, regards to homeopathic therapeutics incorporating psychological interventions. Probably we'll work it out soon.
Especially with this the alcohol addiction, I think allopathic things, we don't have such a reach in the rural area.
Yes,
So we
ma'am.
have to really promote such a kind of, and I have witnessed in my life homeopathy works very well for me, for my health. So I actually
Yes,
vouch
yes.
homeopathy for any of my friends in that case. But what is the thing is the awareness level at Tamil Nadu. I'll say Tamil Nadu, but in Kerala people use a lot of homeopathy or Ayurveda. But in Tamil Nadu, people fall for allopathy and people don't use any other thing. And the reach over for allopathy de-addiction centers are it is very less comparatively. And the amount of addiction, if you look into, it is huge in number. So we have to somehow compensate on these things, and we have to really make a policy decision on working with huge population.
Again, that's a
Yeah.
problem with the policy makers as well. Usually what happens is it's again no a lot of issues like we have to get the uh, proposal sanctioned to go ahead with the studies, and also to find out the efficacy of the medicine. All these things are there, but slowly, at least there should be a start somewhere. We have initiated that process, and we are hopeful that one day we will come out with the results and the study.
I would like to add on one more point here. There are many mushrooming rehabilitation centers regarding
Yeah,
any kind of addictions, drug
unauthorized.
addictions. And
Under,
I had a chance to visit one of the center in Madurai, which is on the way to Dindigul. They asked me, "Can you come and visit?" Because their relative were there. They asked me, "Can you see what they are doing?" When I went there, the practices over there are not scientific. What they are doing, and the movie where one of the movie we have seen, I think, addicted people will be there closed in a room, and they were beaten when they are asking for alcohol and drugs. They were beaten by with sticks and other thing, and they were screaming. They asked me, allow me to walk around there, even they are not allowing. And whenever the person who is saying that even after 6 months, I heard one of the patient that even after 6 months, the person was not allowed to come out from that center. They are still saying if you take him, even he may be even more addicted. So leave another 3 more months for the money. For the money, they are doing it, sir. And I think I had a chance to gone through the
it is
article.
unethical. It has to be
Yeah.
actually
Ma'am, it is there, and then
sued.
most of the centers were not registered at all. Even
That
the
is
center I visited,
unauthorized centers.
yes, unauthorized centers, and those are even I had they given the three psychiatrists who are regularly visiting there. I asked them how they are giving certificate to those kind of practices. I don't know. I don't want to call the name of the center and then who is visiting there, but these kind of practices are going. And whether the document may be manipulated, what they have shown to me is these are the psychiatrists are visiting. I don't know whether they are visiting at all. So these things we have to ensure, and then the person we are taking proper therapeutic strategies, we have to be clearly know what is the appropriate one. And many of them are not aware about which one is appropriate for that. Sir, yes, please
Suresh,
add your points.
Suresh, it is not it. Suresh, it is not just in Madurai. It is there in Chennai. I had visited. It was very scary for me, and it was very scary for me to be there for longer hours. And it was very pathetic. Like they show, like you watch that Mahanadi movie. How in the jail it was there. It was like that. The patients were treated like that. I have seen many patients were then they asked me to just talk to them. They organized one meeting kind of a thing. So all of them are assembled, So when I was talking to them, and a couple of guys are really broken. They have come all the way from Thoothukudi, and they have been, they have been, as you said, their tenure has been extended. Without giving any this thing, you need to be, otherwise, you are not shown any improvement. So like that, they kept on extending their period. See, now mostly, when whoever is asking me any de-addiction center, if they ask, I blindly say, ask them to go to TTK hospital,
Yeah, that is true.
because that
Yes.
is approved, and it is also approved by WHO, and they are the ones who are supposed to audit any de-addiction center. And to set up also, one has to actually consult them, and what are the prerequisites and all these things. TTK hospital should be, it is in India. Anywhere in India, if they are going to put a de-addiction center, TTK hospital should be consulted. That is the norm they have.
Yeah, well
But I
reputed
don't
one.
think even in Chennai people are doing it. It was very scary. So I have, unfortunately or fortunately, I have not entered into de-addiction counseling. It's really scary for me. So I I send it to my friends who are into that. So
And
that is what I do. And most of them I refer to TTK, where a couple of my friends are counselors there. I send them there.
so in
They
Madurai,
are really, really good.
they call MS Chellamuthu Institute of Mental Health and Rehabilitation. They are having three.
Yeah,
They are
Ramudran sir.
IAS officer के आगे दो भी क्या करता है
Rambhadran sir.
See, he's writing. The expert is there with us. I would like to ask you about in Punjab the drug users are actually huge in number. I have come to know that addiction in Punjab is very high.
Yes, ma'am.
How are you actually working a strategy among youth to create an awareness about drugs, and how are you seeing it as a scenario right now in Punjab?
Actually, youth is quite,
क्या हुआ आपका वॉइस तो नहीं आ रहा है
sir. I was seeing the message on Facebook and WhatsApp and all about those who are taking, for example, those who are addicted, they are in trouble now because they are not getting the desired drug or alcohol or something like that, because wine shop, everything is closed. After 3 4 days, the media has reached different hospitals, government hospitals, where a huge lines are there, so, and those who are addicted, they are going there.
okay
Okay, so what is the issue? What they do, they normally, government hospitals, they use buprenorphine to tackle these patients, because they don't have that level of number of manpower, so that they can counsel all of those patients. So what they do is to get rid all of them, is they use buprenorphine. It's a ceiling, I think you all, if you are working with addiction and all, it's a ceiling drug,
yeah
so they use it. So now they are coming for that. Otherwise, government or Punjab government, they have, they make effort. Even in different schools, they organize seminars, conferences and all, workshops to educate them about this counseling. Even I remember there were around 600 students, and I spoke around for 6 hours on this topic only. So there are people, those in NGOs, they are working, and one big major initiative is taken by our military army, Indian Army. So they are also delivering lecture, or they are arranging funds and speakers for the in different states. I think in Kerala or Tamil Nadu, they might be also organizing, but here in Punjab they are also organizing. So they are funding to the resource person, and they are educating people.
Psychoeducation is the primary thing we can give it for those who are in addicted, the first stage.
to youth?
I think it has to start from schools, because we see a
Yeah,
lot of
they are starting from schools, ma'am.
yes, that's what, because a lot of substance abuse is happening from schools, and most of the kids, they are not even aware of all the negativity of this substance abuse, and it's under peer pressure they get into habit of alcohol or smoking. So a lot
Never
of
even
awareness.
know what they are talking. They use broccoli as their language. They'll say broccoli, and it is a drug. And there are a lot of school children are getting addicted to various things, that whitener inhaling, and so many things are there. You never knew that these kind of thing, chemical things, can be people can be addicted. So especially, I could see that a lot of government schools are getting reported for this addiction.
Ma'am, we
See,
are
my
having
friend,
we are having
who's
less
in,
than a minute for this session. Uh,
mhm.
Okay.
okay, I think
Yeah,
another even a small.
We'll have
one last
this
point.
discussion on some other day.
Yes, sir.
We can plan.
Yeah, sure. Yeah.
Yeah.
Okay.
So thank you, sir, for.
Thank you very much, Balbir.
Thank you. Thanks all of you.
Sujata,
Thank
ma'am,
you.
would you like to add a final conclusion point? Madam is there, I think. She's having some technical.
Hello.
Yes, ma'am. Yes, ma'am.
Hello. I don't know whether I'm able to.
Yeah, there is a network problem, I
The
think.
first meeting for me.
Yes.
Yeah.
Yeah. Yes, sir. Yes, sir. So I hope all the discussions just we had it. I was hearing it, and I don't know whether I can speak or not. So I just hesitated to speak in between the discussion. But it was a very good discussion related to addiction and strategies that we are adopting for that. Uh, for me, I want to add up in this discussion. What I have to say is, um, there are people who are doing counseling services even without any training. As said by Suresh sir, in many places, people are doing this addiction in name of counseling without any proper knowledge. I hope so. We should have some certain guidelines for this to streamline the counseling process for addiction. That's what I have.